Aloha, everyone. Thank you for the gift of your time in joining us today. In just a few moments, Governor Josh Green will sign a bill to strengthen support for Hawaii's aging population. Facilitated questions and answers with media will follow promptly after remarks conclude, and the formal bill signing will commence shortly thereafter. Now, it is my honor to introduce Governor Josh Green.
Aloha. Great to see you. First, I'm going to just humbly thank all the legislators, Kupuna Caucus, for doing such great work in this area, in all areas for our kupuna. But this is really important for so many families. I'm going to describe that from a personal standpoint here in a moment. So thank you, guys. And advocates, thank you also. It's critically important that we fight for our parents and grandparents. And it's difficult because I know you're doing that while you're also caring for people that are needing a lot of support. So there's one bill that we're going to sign today, but there are three very significant bills which I think may be touched on by the leaders of the Kupuna Caucus. So I will single out in the moment Senator Moriwaki. Thank you for taking up the mantle of the Kupuna Caucus and bringing everyone together, Democrats, Republicans. We care about our kupuna equally, and it's been extraordinary to see you work together. And Corey, thank you also. For years, you've been a healthcare superstar, and then in the legislature doing the same. So great. And then we have Dr. Fujikami, who has expertise in the area. So to be able to know what our elders need, that is a special profession. It is a specialty that is necessary as we go through the silver tsunami, which is the aging spike in our population and everywhere. So first, let me just quickly touch on this bill, House Bill 1853. Go drop over to the next slide. What this bill does is it recognizes a few things. First of all, our population continues to age. We have the longest lived population in the country because people are healthy, because these legislators have done a great job pushing back on tobacco and making sure people have access to outdoor spaces. And we've all made sure we have health insurance for prevention. So people are living a very long time, but that also means that we have need as we get older. So we lead the country in life expectancy, but we also, therefore, will have great needs as people have some memory loss. This bill establishes the Hanai Memory Network program, and it brings resources to bear. It's going to be a statewide network of dementia care specialists, one of whom we'll hear from today, and support services. It's $3 million to implement the program, and that will need to grow, but it's an incredibly good start. We also know that there are 31,000 or more of us in our state that have these care needs. They're currently living with Alzheimer's disease. That number is going to likely double by 2050. And many of us in the room will go from right now, our 40s and 50s and 60s, and we will be in our 80s and 90s in those years. And that's when all of us will have to have extra support. So it's very thoughtful of you guys to move forward in this way. At the same time that we develop a better comprehensive way to deliver care for those that are wrestling with dementia, we also acknowledge that it has a real impact on all that we do, because we have many individuals, of course, who are Medicare or Medicaid, both, and those are big costs for the state. If we don't do a good job caring for people, then we don't have resources for the full spectrum of healthcare needs, which are very substantial. I'll remind people we have 1.4 million citizens. We have 399,000 individuals on Medicaid alone. And with the oldest population amongst only a few other states, we have a lot of individuals that need Medicare services, which is why it has been very wise of the legislature to help us work on workforce matters, to do scholarships for nurse practitioners and social workers and physicians and primary care providers all across the spectrum. This is all a system of support. So thank you guys for doing that. Now, before I turn this over, I'm going to do two things. I'm going to share just a personal story. My father, who is 81 years old, is wrestling with Alzheimer's disease. And my brother provides wonderful care for him. My dad was very thoughtful and bought a long-term care insurance policy many years ago. it covers both him and my stepmom, who I love, and she's also in memory care, so both of them. Had he not had that foresight, and that's why one of the other bills is so great, that we're going to begin to develop a system of long-term care insurance that will help hopefully everyone. Had he not had that very forward-thinking decision in mind years ago, when he bought those plans, he and my stepmom would be costing $18,000 a month between them, and it would affect, my younger brother, who provides so much care, and I do what I can to help. There's just no way we could do it. I mean, it would be impossible, and he's really struggling right now. So, I'm grateful, really grateful. So, that's important, and that's what every family is dealing with. And I hadn't planned this much before, but I'd like to call up the acting LG just to share a moment, because I know you guys have also been just so touched by the disease, and you've been just a great partner. Would you yeah, guys, why don't you come up and share your story too?
Thanks, Gov.
Thank you.
Appreciate you. Of course. I think the governor's story is one that we can all relate to. We either have family members or friends that have suffered with Alzheimer's and dementia. Bills like that's being signed today, it's going to help families navigate these challenging times that they're faced with. Our own family suffered through our experience with my wife's father, who was diagnosed with Alzheimer's and dementia, and my mother-in-law, who suffered and cared for him for many years as he was struggling with that and ultimately succumbed to that debilitating disease. It was hard on our family. It was hard to find the right resources. We were fortunate that we were able to access some of those resources to help us get through that. But it's bills like this that's going to help future families navigate and be supported in the way that they need to be going forward. So I just want to thank the legislators who really championed these bills. I want to thank the Alzheimer's Association for always being there to support us. You guys are amazing, amazing organization. And I also want to thank the governor. The governor truly cares about the people of this community. And this is an example of exactly that. So Governor, thank you for that. Mahalo, Governor.
Mahalo, Governor, and mahalo, Lieutenant Governor Regan, or Acting Lieutenant Governor Regan, and, of course, Lynn. That was beautiful. I would next like to introduce Senator Sharon Moriwaki, co-convener of the Legislative Kupuna Caucus.
Aloha, everyone, and thank you, Keith, for our Lieutenant Governor, for sharing that, and Lynn and Governor. I think all of us have someone in our family or our friends in the community that have really had to struggle with how we deal with the cognitive decline of people we love. So I really appreciate my colleagues in the House and in the Senate. And Governor, thank you for your continuing support for this, and for all the advocates that made sure that we continued this journey. You know, it's been 15 years since we passed a bill to develop a state plan on Alzheimer's disease and dementia. We went on to fund the Alzheimer's Coordinator and the Executive Office on Aging. We also funded faculty, and now faculty are in the medical school will be coordinating dementia care and education, and also public education campaigns. And thank you, Alzheimer's Association, for the continuing campaign to let our community know about this dreaded disease and things that we can do. Much more is needed, but we have had research now proving that we can prevent and reduce the risk of developing dementia. We're improving the support to those with Alzheimer's and their caregivers. But much more is needed. to tackle the sixth leading cause of death. You heard from Governor the 31,000 living with Alzheimer's. That number of new dementia cases is expected to double by 2050. And today, 1 in 10 adults over the age of 45 are experiencing cognitive decline. So it's all around us, and we really are thankful to the governor for signing these bills and the others on long-term care financing for these kinds of issues that are going to be even more prevalent in the years to come. But for too long, those with Alzheimer's and dementia have received fragmented, reactive, and crisis-driven care, or none at all. So families across the island, everyone, especially in rural communities, are struggling with delayed diagnosis, a lack of coordinated support, and the high cost, as you heard Governor say, the high cost of long-term care. If both parents and both even more, many more in your family are needing long-term care. And our long-term care infrastructure is stretched thin. And dementia-related Medicaid spending is increasing at an unsustainable rate. Without action, these pressures will only intensify. This is why this legislation is so important. The Hanai Memory Network, and it's a long name, it's the Hawaii Assistance for the Navigation of Alzheimer's Intervention, and that is the Hanai Memory Network. It is a coordinated statewide approach to dementia care, serving all islands and especially rural areas. It creates a system that shifts from crisis response to early detection, coordinated care planning, access to treatment, and proactive support for individuals and their caregivers. It will establish community-based dementia care specialists, expand access to diagnosis and treatment through memory clinics, build a statewide referral network, create a public information hub, and ensure training, data collection, and strong partnerships across all providers. It will help families get answers earlier, reduce avoidable emergency room visits, and connect caregivers to the guidance they need. With this bill, we are making a meaningful investment in our kupuna, their caregivers, and the future sustainability of our healthcare system. The Hanai Memory Network will help ensure that residents on every island, no matter where they live, have access to timely, coordinated care and support. By investing now, we build a network that cares for and supports our kupuna and families facing what has heretofore been a hidden and a dreaded disease. I am so, so grateful to all the advocates, the caregivers, the professionals, the Alzheimer's Association, and other community partners who have contributed to this significant commitment to our kupuna, their caregivers, and our collective future. Mahalo nui loa, and thank you, Governor.
Mahalo, Senator Moriwaki. Now please welcome Representative Corey Chun, co-convener of the Legislative Kupuna Caucus.
Good morning, everybody. First, I'd like to just say mahalo, Governor, for signing House Bill 1853 today. And also to Chair Takayama, who introduced the bill. To all of my colleagues, the Alzheimer's Association, our community partners, advocates, caregivers, and everyone whose dedication brought us to this day. As we all know, Alzheimer's and dementia doesn't just affect the individual receiving a diagnosis. It impacts entire families, caregivers, and communities, placing emotional and financial strain on those who are already facing an incredibly difficult journey. For too long, many families, often the most vulnerable, have had to navigate dementia without knowing where to start or where to turn for help. Like other measures the legislature passed and was recently signed by the governor, the Hanai Memory Network changes this by bringing together information, referrals, and coordinated support so families can find accessible help earlier and before these challenges become a crisis. Really, no family should have to navigate dementia alone. The Hanai Memory Network gives families a place to start, a place to turn, and a network that walks beside them throughout their journey. Mahalo to everyone who helped make this possible. I look forward to the difference this will make for our kupuna, their caregivers, and families across our state. Thank you.
Mahalo, Representative Chun. Up next, please welcome Dr. Gina Fujikami from the Queen's Health Systems.
Aloha, everyone. As a geriatrician, I have the privilege of caring for older adults and their families across Oahu and the neighbor islands. I am honored to be here today because HB 1853 represents something that I know families throughout Hawaii desperately need. And I wish I had this back when my grandfather suffered from Alzheimer's dementia 30 years ago. One of the most difficult parts of my job is meeting patients and families who have been experiencing memory changes for years, but were unable to access the evaluation, support, or specialized care that they needed. Too often, by the time patients reach me, the disease has already progressed significantly. Families often tell me, "We knew something was wrong, but we didn't know where to go or what to do." Or, "We thought Auntie was just getting senile. Isn't that normal?" As physicians, we want to identify cognitive changes as early as possible. Early diagnosis helps individuals and families better understand what is happening, plan for the future, access support services, and maintain independence for longer. And today, early diagnosis has become even more important because we are entering a new era of Alzheimer's care. For the first time, disease-modifying therapies are available that can help slow the progression of Alzheimer's disease for some patients. But these treatments require timely evaluation, accurate diagnosis, and access to specialized memory care. We cannot take advantage of these advances if patients are identified too late. That is why the Hanai Memory Network program is so important. This legislation creates a pathway to care. It brings memory evaluation and support closer to the communities where people live. It helps connect healthcare providers, community organizations, patients, and caregivers. It ensures that families are not left to navigate this journey alone. Hanai represents a shift from crisis response to early intervention, no matter what island a person lives on. What gives me hope is with earlier diagnosis, better care coordination, stronger community support, and access to new treatments, we can change the experience of those living with dementia for thousands of Hawaii's families. Today is an important step forward, and I am proud to celebrate it with you all. And again, mahalo for all of you for your support today. Thank you so much.
Mahalo, Dr. Fujikami. At this time, Governor, we have a question from Kai at Hawaii News Now.
We talked a lot about the cost, the financial burden that dealing with these diseases can put on a family. Yeah. How will this Hanai network be made available for people who just don't have the income to try to combat these later on? Are we saving a lot of money by doing this preventative care as opposed to the way that it's being handled now?
Come on up again, Doc. So a couple things. First and foremost, one of the most expensive parts of the disease for families as they wrestle with the decline in capacity is having to live in a facility. And if someone has to live in a facility, a memory care facility or assisted living, it can be $5,000, $6,000, even $10,000 a month or more. If someone gets diagnosed much earlier, people can set up services at home. One of the big moves in healthcare is going to be to lean towards home care services, to have more professionals in the home setting so that our hospitals and our institutions don't always have to be the only option for patients. And so that is our hope. Also, our geriatrics teams will be able to hopefully get people onto treatments earlier and extend the amount of time before someone who perhaps has very severe Alzheimer's dementia would have to be supported by a whole team. I could tell you, for my dad, it would be impossible for my younger brother and I to provide enough care, just given his needs right now. So we need a team to help. And he was able to stay at home for some time, but he would have preferred, I'm sure, to live independently even longer. And that is a part of the reason for this.
That's a great question. I think just to echo the governor's statements, with this disease, we know that there is no cure. But again, there's ways that we can prolong the independence, right? And not have someone go to a nursing home in 5 years, maybe 10, 15, 20 years, and also maintain quality and dignity of life. So if we can diagnose earlier and start them on the right treatments, better prepare for the future, have all their long-term care planning in place, financial, medical power of attorney in place, that would save the healthcare system, our communities, and the families themselves, and the patients suffering from the disease a lot less stress.
Mahalo, Governor. Any closing thoughts?
Just again, there's at least three things that are happening today because the Kupuna Caucus was so thoughtful about this challenge. One is getting a lot more people in society the option to get long-term care insurance. That's been something we've wanted for a long time, and we're hopeful that in the coming, say, 18 months to 2 years, we have a very good plan that comes from the legislature that we can implement. That's the front side. And then the middle side is getting more care, just treatment. That's where our commitment to getting more access to care is and will always be important. And then finally, again, reshaping how we do have larger scale institutions. And as our population gets even older, what does that look like? How can we get people to have home care? So all of these are critical pieces. But this is very foundational, what they've done. So always look at these challenges in terms of systems. It can never just be one solution. It has to be a system. And if the system is successful, it will also alleviate other challenges because there's a lot of healthcare needs out there. There are people suffering diagnoses of cancer. We talked about colonoscopy and access to that. The Health Caucus did a great job on that. We've also been having these discussions about, will the healthcare system have to change? Will it evolve as some of the big players talk about partnerships? That will be something that they have to convince us is going to be in the interest of all the people of Hawaii. But meanwhile, these solutions are really meant to change how we do healthcare. And then finally, I would just say my role as the chair of the Western Governors Association, our health initiative is Health Beyond Healthcare. This is what we're talking about. In many ways, the health beyond healthcare will be having people be in the right setting to get support, because in many instances, it could be the caregiver or the social worker that does a great deal of the work while the geriatricians or the emergency room doctors are able to take care of those who need it most with the most severe challenges. So as a family, as Nohana in Hawaii, we think we have the right approach because of these good people.
Mahalo, Governor. I would now like to invite state legislators and key stakeholders to come up to the podium and join the governor for the formal bill signing and subsequent picture taking.
I haven't seen you in a while. No, we just missed each other. I see it. Yeah. That's what I see it. You're like, oh God, not again. It's good to see you.
Okay. All right, here we go. Sorry, brother. Good.
Wait.
Thank you. Oh.
Okay.
So, when is the Alzheimer's walk? What day? What day? November 7th. Okay. So, again, for all those who have a family member that is wrestling with Alzheimer's, dementia, for everyone who's done so much, the Alzheimer's Association, more than almost anyone I could imagine, we thank all of you. And then this legislative team has been extraordinary. And if I may, November 7th will be the Alzheimer's Walk at Magic Island. And we would welcome everyone to come out and learn more and to participate in that special moment. And we can reflect on how we can best care for people in our lives that suffer with Alzheimer's disease. There you go.
Mahalo, Governor. This concludes our formal program. Mahalo.